You don't know how to navigate everything that you're being hit with when you're diagnosed with cancer. It's just so much of it.
They're wonderful people. They're awesome people. They help us get out through this hard time, make it a lot easier.
And they can take it piece by piece and assure you that you're going to be okay.
Arizona Oncology is the largest medical group in the state devoted to cancer care. And by being united in healing with the U.S. Oncology Network, they extend nationwide resources to patients at all times. Arizona Oncology knows each cancer is unique, and so is every patient they treat. Their team of experienced physicians and staff is dedicated to providing the most comprehensive, compassionate, cost-effective cancer care every day. And it's all personalized care.
Personalized means many things. I mean, obviously we try to adapt to the patient's needs, and that includes, their living arrangements, their family arrangements, their economic needs. Many patients will travel hundreds of miles to come to this practice, and one of the nice things about Arizona Oncology is we cover the entire state.
It's really more personal. They really get very close with the staff and the physicians, and the staff gets very close with the patients and their families, and it's a very rewarding and gratifying experience for us physicians and the staff and the patients themselves.
So the U.S. Oncology Network is one of the largest cancer treatment and research networks throughout the country. We're part of U.S. Oncology, and that allows for our patients to benefit from the collective experience of over 1,000 physicians throughout the country.
And nationwide, there is something called the Oncology Portal, where any physician within this network can enter information into these virtual tumor boards. And there's experts in different areas of medicine and oncology. And we can post a case, of course they're all anonymous information. You can post images and some history on the patient, and then you can get opinions from everywhere across the country.
And the full range of services that is accessible to Arizona Oncology patients is also integrated in a community-based setting, so family and friends are always close by.
We've now got 9 office locations in the Valley and work at many of the different tertiary hospitals in the Valley. And so all of our patients will be within a relatively short travel time to one of our offices or one of our designated hospitals that we partner with.
We also have our experts in medical oncology and GYN oncologies, and also in urology at different locations, so patients can also see the doctors and go to the nearest center for their help.
One of the busiest areas at Arizona Oncology is the Infusion Room, which can treat up to 50 adult chemotherapy patients at a time. This is where the nursing staff shines by creating and cultivating a tranquil, comfortable, and upbeat environment.
Some are here for an hour, some are here all day. So they really come together and share their experiences, and the staff become part of that. The nurses see these patients frequently, sometimes weekly, daily, depending on their treatment regimens. And so there's a real bond that develops between the nursing staff and the patients, as well as patients among themselves.
There's camaraderie within the employees, and you sense it as a patient, and you can, and I'm one that likes to banter, so it was a good fit for me.
They were like family to me, because I saw them every week for 18 weeks. That's a long time. And you're not there just an hour. It was 4 to 5 hours. So you become very close.
Arizona Oncology, along with the U.S. Oncology Network, brings together all the resources and services needed to diagnose, treat, and counsel cancer patients and their families here in our state.
We're dealing with a lot of life and death situations, and there's pressure on us, to try and do the right thing all the time and make sure that we're current and delivering appropriate therapy. And but it's very fulfilling because we do have a lot of good outcomes.
We are there at every step of the way, and we are with the patients, supporting the patients. And it's multi-leveled. It's like emotional support, medical support, social support. So it's a tough journey which we all go through with them.
It is the most gratifying thing when you get that thank you from the patient that really makes it very meaningful.